Hi, I'm Dr. Valerie Sutherland. I'm here to give you a brief overview of our programs here at Rainier Medical. What we'll cover today is goals of care, the different phases of our programs, our program options, a little bit about medical foods. We'll go over some important facts. We'll talk about the use of medications, and then we'll cover some frequently asked questions. Remember, this is just general information, and I encourage you, if you'd like to learn more, to schedule your individual appointment because all of our programs are tailored and everybody's circumstances vary. So our overall goal is about 20% weight loss in about 12 weeks. Of course, if that is an appropriate amount. We always want our programs to be as safe as possible. We want them to be well tolerated, and we really provide a positive atmosphere. It's important to note that weight recurrence is expected without a maintenance plan, and so we really consider everybody to be a lifelong partner, and really our programs don't end because no matter how a person loses weight, whether it's through surgery or medication or lifestyle, studies show that weight recurrence is physiologic. And so please make sure that you have this expectation when you start. Remember that if your BMI is 40 or above, or if it's 35 with a medical condition such as diabetes or high blood pressure, that bariatric surgery may be an appropriate alternative consideration for you. And so remember that you need to be aware of that and consider that option also. So our different phases, we start out with an evaluation. So each person fills out paperwork, of course. We'll perform a body composition to really understand your own body. We'll then have a new start appointment. Then we'll go through the phases of adapting to your program, then active weight loss, where the majority of weight loss will occur. Then we'll transition to a maintenance plan. And then it's normal to have some weight recurrence over time. And so we have a recovery plan so that we can minimize weight recurrence. Our motto is it's better to lose 5 pounds 10 times than 50 pounds once again. But of course, lots of different things can contribute to weight recurrence. So always positive and encouraging if that happens. So during your evaluation, of course, there's paperwork where you'll be asked to fill out about your weight history, as well as medical conditions and medications. There'll also be an insurance verification so that we can be transparent and upfront about out-of-pocket costs to you. There is a one-time enrollment fee. Then you'll have an office visit with myself. That's typically about 45 minutes. During that time, I'll perform a medical history and exam. I'll review the blood work that is available and order any additional blood work that is needed. And then together, we'll come up with a treatment plan. So there's 3 different nutrition plans. We always encourage people to self-select the nutrition plan that feels right to them, of course, with guidance and input from myself. There's 3 basic ones. The first one is our full gold standard plan. That's called the Expeditions plan. In that plan, all of your nutrition comes from medical foods that are fortified so that you can get all of your nutritional needs met with a low calorie amount. So this is the plan if you are looking to lose 20 to 30% of your starting body weight that I would encourage you to select if it's appropriate and tolerable. The weight loss rate may be between 3 and 7 pounds a week, but many factors can affect this. Your nutrition is 600 to 900 calories a day. Everybody eats 5 times a day on all of our plans, so every 3 hours and 3 meals and 2 snacks. On the Expeditions plan, there is a nutritional ketosis, and that will help control symptoms and hunger. Not everybody is medically eligible for a ketogenic plan, and so that is part of what we'll go through during the evaluation. During this plan, it's important to note that vigorous exercise is not recommended and alcohol is not safe, and it does require the medical screening, and it's not appropriate for people with type 1 diabetes or on certain medications such as lithium, but all of those things will be evaluated during your initial evaluation. If the expeditions plan is not right for you for whatever reason, in general, if there's 30 pounds for a woman to lose or more, or 40 pounds for a man, the expeditions plan is appropriate. But if it's not desired or medically not appropriate, our next plan is called the summit plan. The summit plan, the weight loss is about 2 to 4 pounds a week, about 15 to 20% weight loss. In this one, there's about 800 to 1100 calories a day. This also is nutritional ketosis, so it also does not recommend vigorous exercise or alcohol. You do have one grocery meal per day that you prepare and provide on your own, but it is a rather structured grocery meal. And so there will be 4 medical foods throughout the day. So again, 5 eating occasions a day. Our third plan is called the peak plan. That plan is appropriate for people who are okay with a slower rate of weight loss. They'll provide 2 grocery meals on their own. This will result in approximately 1 to 3 pounds of weight loss per week and a total weight loss of about 10 to 15%. And alcohol is not recommended, but if it's not ketogenic, then if there's an occasional drink, that may not be a problem. So let's talk about the medical foods. The medical foods are an important tool. They result in optimal weight loss because they have weight loss that is more tolerable. So really have a high level of satiety or feeling full and the fullness lasting. When a person loses weight using the medical foods, it's much more predictable and it results in a larger amount of total weight loss typically than when it is done without medical foods or on a self-directed nutrition plan. The weight tends to come off at a faster rate. That has benefits that are both physiologic, because studies show that the faster a person loses weight, that the more weight that they will lose. And studies also show that the more weight a person loses, the more likely it will stay off. So there's maybe fewer side effects with the medical foods because you are eating 5 times a day and because they do contain complete nutrition. And then they also result typically in a healthier or more favorable ratio of fat to muscle loss. So when a person loses weight, typically 20 to as much as 30% of it may be lean body mass. This can have negative effects on the metabolic rate, which can make weight loss more or weight regain more common. And so when a person is losing weight with structured medical foods that are fortified, it's more likely that they'll just lose fat and keep their healthy muscle. Also, this do not require any medications or surgery. It's really simple nutrition that's provided for you. So during your new start, that is when you'll meet with me and you'll decide about which plan you want to do in combination with myself. You'll have an orientation that may be done by one of our team members. You'll get set up with our app that allows you to track your program and communicate with us and track your progress from home. You'll also get to select any medical foods that you might be using, and we do have an allergen-friendly line. And you'll get your follow-up visits scheduled that work for you. The first 2 weeks of the program are called adaptation, and during that, you're both physically adapting to the program and also just getting used to the routine of eating about every 3 hours. We'll be making adjustments based on how you're feeling and what's working for you, and that's an active dialogue. We'll work through any curves or symptoms and get you to smooth sailing. So we're very open for communication. During the active weight loss phase, that's about weeks 3 through 12 or up to 24 weeks, depending on the amount of weight that there is to lose. During this time, we'll really be supporting you to work the program and providing accountability, support, guidance, and then, of course, adjusting your program as your individual needs dictate. When you are 5 to 10 pounds from your goal weight, you'll enter the transition phase, and that is where you move from the expeditions plan to the summit plan and then to the peak plan. So you'll be introducing more variety into your diet and some additional calories as well, and working towards getting towards your maintenance program. You'll also practice flexibility during this time, social situations, and so that is an important phase. During maintenance, that is really the most important part of the program. It really is lifelong, but the first 2 years are the most important. That is when it shows that if a person keeps the weight off for 2 years, it's more likely that the weight will stay off. So for maintenance, I encourage people to use our peak program. Important things to note are that in maintenance, a person does still need to maintain a calorie deficit compared to where they started. We provide ongoing remote monitoring with Bluetooth scale at home that syncs to our app, and our nurse and program director can monitor and communicate with you so that if weight regain starts to happen, then we can intervene and support as soon as possible. There's no particular nutrition plan that is recommended. The one that works best is the one that's most tolerable and, of course, effective. So in general, a Mediterranean type diet, for example, is what we get to. If medications are used for weight management, those may be continued during maintenance as well to prevent weight recurrence, and we'll talk a little bit more about that. This shows what the schedule looks like for a program. So you can see that there's an evaluation, and so if you're starting at a starting weight, then during the first 10 to 20%, you'll likely following our expeditions plan. And then for weeks 12 through 16, that may be a transition plan, and then our peak plan following that. As far as appointments, we really encourage weekly appointments for the first 4 weeks because you may be going through a lot of changes, and we really want to support you and find what works best for you. If things are going very smoothly after that, you can transition to every 2 weeks during weight loss while still maintaining contact with your Bluetooth scale and monitoring on our app. Although many people like to continue to come in weekly for the 12 weeks of weight loss because the body compositions that are performed each time you come in, and then just the adjusting of things based on what may be going on in your life is really helpful, as well as, of course, getting additional medical foods for the next period until they come in again. And then in maintenance, we encourage you to come in once a month for 3 months. And then after that, definitely every 3 to 6 months, and anytime your weight goes up 5 to 10 pounds. Medications, there are medications that are FDA approved for weight management. These are anti-obesity medications, reflecting that they're used for weight loss as well as for preventing weight recurrence. Important things to note, we do use them on and off label if that is accessible. They may be used for a short period of time, such as 12 weeks, or they may be used for a longer period of time as a long-term maintenance medication. Important things to note is we, of course, always emphasize using them in combination with the rest of our programs, because studies show that really results in the best outcomes. But we do recognize that medications are an important component of the treatment of the disease of overweight and obesity. Now, another important thing to note is that weight recurrence can commonly occur if the medications are stopped, if they are not accounted for with some sort of nutrition or exercise or some other sort of adjustment. And so we want to prevent people experiencing weight cycling, which is where people lose weight and gain weight back. So I'm always very transparent up front about weight recurrence if a medication is stopped, if that effect is not made up for. So that's why I recommend when medications are used that they're really used as part of a comprehensive approach, and that people are fully informed about what the studies show about weight recurrence in the period of time after these medications are stopped. Some benefits of the medications are that they can confer control over eating. They can also treat energy dysregulation or low metabolism, as well as metabolic adaptation to weight loss, which is where metabolism slows down after weight loss. They're also used if a person experiences initial weight loss, but then there's a weight loss plateau that's at a higher weight than is clinically beneficial for that person. And then sometimes people can lose weight without any problem, but it's really the weight regain that has been a challenge. And so that's an important role for anti-obesity medications. So I really individualize the conversation based on a person's medical circumstances and their experience, and really involve the individual in what is most appropriate and at what time or phase. So important facts about our program. We bill most insurances for our services. We have a typical financial policy for a medical practice. Again, just setting the expectation that without a maintenance plan, weight recurrence is expected. So we do consider everybody who does our program to be a lifetime client or patient. The weight loss is not without risk. There's always a recommendation to check with your physician. And so we do have an informed consent form, and I'm happy to answer any questions. Another thing is that intensive behavioral therapy has been shown to be an important component of weight loss, specifically 22 visits in 12 months. We are flexible when it comes to virtual visits and remote physiologic monitoring so that we can achieve that support and guidance and follow up with some flexibility to fit into your schedule. Again, our goal is really that you feel supported and that you have resources, because weight loss is hard and weight maintenance is hard, and we really want you to have the full benefit of the program. Our environment is a no stress, positive environment. And so we really want people to look forward to coming in, no matter what their circumstances are at the time. And we realize that people go through different things, and a person may need additional support at some times, or they may need to take a break for a period of time. And we are supportive, and we are asked that you communicate with us, and so we can meet your needs. Cost, we do have insurance verification available, or we can provide you with the codes that we use if you'd like to contact your information. The medical foods, if you choose to use them, are currently about $4.50 for a meal and about $2.75 for a snack. The enrollment fee is, again, a one-time fee because we consider everybody to be a lifelong partner. And our goal is, of course, to provide very high value care that really saves the burden of medical disease and the need for healthcare in the future. So next steps, we would invite you to schedule a consultation with myself and bring your questions. And if you're ready to start, then you can schedule your new start appointment. And if the timing isn't right now, right now, then we're here when it is. Or we'd also encourage you to come talk about your situation, and maybe a less intensive program like our peak program would work for you at this time. What's really important to know is that even modest weight loss of as little as 3% has important health benefits. And so while we do offer more intensive programs with larger weight loss, that even modest weight loss, 3 to 5%, has important health benefits. So whatever your goals are, we're here to partner with you. So we have our website down here, as well as an email address, and please let us know how we can support you. Thank you.